Hello, I'm Dr. Madina, breast radiologist and oncologist, CEO of Delegata Medical Treatment Facilitation Company in the UAE and Europe. And today I'm happy to have a conversation with Professor Dr. Tamer Salama, surgeon and one of the first healthcare excellence providers in the UAE.
Hi, Medina. Good evening. And honestly, I'm happy with you today. I see with myself how do you take care of your patient, how you always search for the best quality service. I see the huge number who is following you and the trust of the patient for you. So I'm really happy to be with you today.
Dr. Tamer, is there a particular type of surgery that always leaves you feeling especially fulfilled after performing it? What do you think helps your patients feel truly connected and loyal to you? What sets you apart from other surgeons?
This is a very tricky question. Let me tell you, you want the whole secret today. Psychological support for being part of the family of this patient. I'm not dealing with a patient. I'm dealing with one of my family, one of my brothers, one of my sister. What I'm going to do to my brother or my sister if he need a surgery? How I'm going to deal with him? How I'm going to support him psychologically? Let me tell you something. Anyone can do more. Can
And I think also how you deal with complications or with very complicated cases.
Definitely, the patient should know the rate and the risk of complication before, because there is a study showed that if I clarify to the patient before any procedure the incidence and the possible complication, this by self decrease this incidence. Why? Because he knows that he trusts his surgeon. He know that even if this complication happen, he can deal or manage it. This is very important point in trustability with the surgeon.
You are well known as a bariatric and laparoscopic surgeon. What inspired you to expand your expertise and lead Center of Excellence in Proctology, a field many people are shy to even talk about?
See, this is a very tricky question for a reason. Let me tell you something. Before I'm bariatric surgeon, I'm a surgeon who have some beliefs. What I believe in is minimal invasive surgery. What we mean by minimal invasive surgery, we mean that I make the smallest or the minimal incision for the patient, the minimal pain, the minimal uh, 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 stay in the hospital, the minimal operation time, and the fastest recovery time. This is what we mean by minimal invasive surgery. So, as a surgeon, any procedure is going to fulfill this five criteria. Again, minimal pain, minimal hospital stay, fast recovery. It's very important for any patient. This is my role. So, any procedure is going to satisfy me as regard this 5 point and it's going to fulfill it. I'm going to do it in my area. So, this what happened with the proctology, that we reach techniques which can fulfill this criteria.
So, when you started to work in Dubai and you have been working for a few years already, and you were well-known surgeon here with good reputation, good experience, and actually you could choose any hospital. Why did you choose Saudi German Hospital?
Let me tell you, Medina, I have a philosophy in my work. Again, I'm working only in the excellence place. I'm looking always in the excellence pathway. As you said, I'm one of the leader for the excellence healthcare service providers. So that means when I'm choose my hospital, I should choose a hospital who is aligned with my thinking, with my philosophy. Honestly, the manager and the whole system in the Saudi German was aligned with this. They are taking for the best healthcare service, excellency in the healthcare service. This is very important to me, apart from any other thing. And this is a crucial point because the only thing which can make me make a move in from any place that I feel that I'm not going to give my patient the excellency. This is very important.
If we speak about your bariatric part, nowadays Ozempic and Mounjaro injections are so popular. Do you think these medications could replace weight loss surgery one day?
Any wise surgeon should not deny that Monjaro and this type of medication make a jump in the treatment of weight loss, but it should be used in a wise manner. It has a certain indication. I cannot use this medication for a patient with BMI or excess weight 100 kilogram. It's not logic. So we have a clear indication for this medication. Yes, it's very good. Yes, it's working, but for clear indication for the patient who has overweight like 30 to 40 kilogram. I cannot come to patient with 100 kilogram over and I said I'm going to use Monjaro. At the same moment, we have a very two important question. What is the possible complication to this medication and for how long we can use it? This is a very important point because when I use something with any patient, I used to tell him how long I'm going to use, what is the complication, when I can stop. So all of this question is still under investigation. Again, this medication is a good, but it should be taken under supervision of a doctor. It should be taken in certain indication, and it will never replace the bariatric surgery.
Amazing. Like everything in medicine, any medicine or procedure has indications and
See,
contraindications that you should keep
let me
in mind.
surprise you. Bariatric surgery is the
Mhm.
most elective surgery procedure done daily worldwide. This statistic analysis, it's the most elective surgery. So
Mm.
in case we have a medication which stop, it will be announced officially in the whole world. It will not be under discussion like this.
What's your message to people who've been taking acid reflux medications for years without investigating exact root problem?
See, Medina, this is a very old medical practice, okay? And it's out of the recent guideline for reflux disease. Reflux is a disease which is curable. We have a treatment, we can cure it, and at the same moment, it have a long-term complication, as you know, definitely, carcinogenic transformation, which is very risky to any patient. So my message to any patient, please, my friend, a reflux is not a chronic disease, is not the disease which you are going to take a medication for life. No, we have a treatment, which is a very simple treatment or even procedure, which took around 30 minutes and you can go home same day, next day, with no more reflux, with no more reflux. So please, if you have a reflux, seek for medical advice with someone who have an expert in this.
What would you say to someone struggling with anal pain or discomfort but too embarrassed to see a doctor?
The most difficult issue for anal issues is that the shy point. You know that we find that the most searchable word in the Google in Middle East is the anal issue. So you imagine that 90% of the patient took their information how to treat from from the Google.
I'm sure not only in Middle East, all over the world.
So what I want to say, my friend, don't be shy and don't be afraid from any pain. Again, there is a lot of highly specialized clinic for this issue with complete privacy, with the most advanced technology used to diagnose in a minute. And the most important point, the treatment of this issue now is totally pain-free. Pain-free. I'm again speaking. The treatment for anal issue, mostly now with the new techniques which we use, is a pain-free. It doesn't take any time, and you can go back your work after 2 days.
Mhm. And why was it so important for you to open Center of Excellence in Proctology?
See, let me tell you something. Center of Excellence is not a certificate which you can put on a wall. No, this is not that the main. Center of Excellence is a behavior of success, behavior of excellency in your. Excellency is something we used to do daily. This is what I'm doing for a years with every patient. So the certificate is just documentation or guarantees that you are going to receive excellent healthcare service in with this surgical team. We just document everything we do. That's it.
Many people confuse minor symptoms with something harmless. What signs should never be ignored when it comes to colon or rectal health?
See, rectal or anal area is a very sensitive area. So whatever the symptom you feel, you should seek medical advice. Don't hesitate and don't think and don't search on Google. Definitely, you have some alarming sign. The most important of it is the bleeding or dripping of blood. But even if you don't have if you don't have a bleeding, but you have, for example, swelling, yes, you should go to medical advice. If you have an itching, you have any discomfort in this area, please search for medical advice, especially that we have the tool or the most advanced tool which can give us a clear vision for what you have, and it just take a minute. So search for it.
Okay. And how do your modern tools or technologies like laser, robotics, or minimally invasive surgery change outcomes for patients today?
See, I will speak with you about this new tools for diagnose and for treatment, but you should promise me to visit and to see it by yourself in the hospital.
I promise.
to I need to show our patient how this new tools looks like. They deserve to show this.
Yes, we will show to our followers.
Yeah, yeah. See, as regard the diagnose, we have a machine named as HR Station, which is the unique and the only one in the Middle East. I'm not speaking about UAE. Is the only one in the Middle East for diagnose of the whole anal or proctology disease. It contains a high 4K camera, which magnify more than 50 times, so I can see any type of lesion you can imagine. I have something known as inometry for diagnosis of any possible leak or uncontrolled for flatus, for gas, for stool, whatever. I have endoanal ultrasound which diagnose the fistula, very high sensitive endoanal ultrasound for diagnosis of the fistula, any sphincteric injury. Again, the whole procedure or the whole investigation took around from 5 to 10 minutes. We can screen all of the disease we speak about.
Okay. And let's talk prevention because some even very dangerous diseases can be asymptomatic. So, what are three habits that help people avoid proctological issues altogether?
Can I say two or I have to say three?
Okay, let's say two.
See,
Up to you.
the most two dangerous habit is chronic constipation and spicy. This is which is very common. Yes,
Spices.
yeah, definitely.
Mhm,
Please, my friend, please stop eating spicy. Stop
mhm.
eating spicy. And if you have a constipation, we should investigate it and we should know why and we should to treat it. There is another factor, but not such powerful like this. For example, it's very common after pregnancy. You know, it's very common for the people who are sitting for a long time. So if you have a routine work or you're sitting for a long time, please go and walk every now and then to avoid such complication. But again, I'm going to say the most two important point to me: avoid spicy and avoid constipation.
Okay, this is regarding hemorrhoids.
This
Or
regarding hemorrhoid or even fissure. If you are speaking, 70% of the anal issue is a hemorrhoid and fissure. Yes,
yes,
to less degree, around 20%, it will be like fistulas. But the hemorrhoid and fissure represent around 70 to 80% of anal issues.
a lot of stigma around conditions like hemorrhoids or anal fissures. How can we help normalize early consultation?
See, let me tell you something. Because of the sensitive point we speak before or the shy point, we have a full team with including ladies who is responsible to prepare for this type of patient. And again, we have a full uh, updated investigation, okay, which will take a very minimal time, around 5 to 10 minutes, which is are done by these ladies, which I told you. So we took in our consideration how to consider or to respect the privacy of our patients.
Mm.
We did it.
In your opinion, at what age would you recommend people start paying closer attention to colorectal health, even though they have no symptoms?
See, in the before, we used to see patient under the age of 40. But let me tell you honest with you, nowadays I start to see from any age. I start to see 18, 19. You know, our unhealthy lifestyle, you know, the one of the most important point which make it start to come in early age, gym and lifting heavy object, you know, all of the youngs or all of those is got involved in this gym and knowing to do certain carrying certain weights. So this is one of the most common cause now for the hemorrhoid and for anal issue. So what I mean, nowadays we don't have a certain age. I can tell you it's from 18 up to any
Okay.
age. Yeah.
Yeah, but this is when the problem appears. But if the person is asymptomatic, uh, is there a certain age where the screening should start for
See,
colon or rectal
let me
cancer?
tell you something, Medina. The problem is the hemorrhoid. If we're speaking about the hemorrhoid is a painless disease. It
Mhm.
become painful only when it become complicated, like there is a thrombosis, there is inflammation. So sometime the patient come to me and he is fourth degree hemorrhoid, which is protruding outside, and the treatment is very difficult, and he feel it suddenly. So what I mean, my role is to treat it early. If imagine if we try to treat this hemorrhoid in second degree, it will be
Mhm.
much more easier or not. definitely it will be
Correct.
much more easier. So wherever you feel something abnormal in this area, don't wait until I'm asymptomatic. No, my friend,
Mhm.
you shouldn't come to me in the complication. You should come to me early to treat it early to get the best
Okay.
result. Yeah.
No, but just for myself, do you do surgeries for cancer or only benign
No, no,
condition?
no. We did it for
You do?
definitely yes.
Okay.
We did it. We did it for
Mhm.
malignancy. Yes.
Okay. Do you think that Dubai has become a hub for medical tourism?
Definitely, definitely. Dubai is a hub for medical. Let me tell you something. Before, when you ask any of your friend, I need to go to luxury place to take a vacation, to go a nice restaurant, to make a nice shopping. You're like, yeah, perfect. Go to Dubai.
Mhm.
That's right. Nowadays is,
Absolutely.
but nowadays this is not only this. When you ask one of your friend, I need excellent medical advice, and I have this issue, and I need to go to place. He'll tell you, yes, go to this doctor. He's an have a center of excellence or excellent in this specialty. Go to Dubai to Doctor
Tamer,
Tam.
of course.
You said it. I'm not.
Who else has excellent center in proctology? Nobody
By the
else.
way, let me tell you something. This is my third center of excellence only in Saudi German, and
Mhm.
my sixth. This is the sixth center of excellence in my life. I have a center of excellence in bariatric. We did around more than 200 cases in the past 2 years. We have a center of excellence for minimal invasive surgery, like treating reflux, hernias, lap coolies, and the last one was center of excellence for proctology, which is I consider it the best one or the final end, as we said. Yeah. Mm,
Mhm. I want to ask you a question I'm very often asked.
mm.
Do you think that Dubai is more expensive than other countries with the same level of medical science and equipment, of course?
By calculation, and as you said, by the pen and calculation, never. Because in comparison to the service you get, this is your life and this is your health. My question to you is: are you going to invest? If you're not going to invest in your health, what you are going to invest with? So here, the point is, you take a certain healthcare service. We use a certain instrument. We use to do our procedure in a high quality hospital, the best instrument, the best technique. So definitely, in comparison to this cost, it's nothing. No, no, you cannot compare it to any other area. So if you're speaking about, for example, we are the first center of excellence accredited for proctology. We did a lot to reach that level. We use a certain instrument. This is during our conversation, I told you that the machine we have, the first in the Middle East. So what I mean to be the first in the Middle East, the first surgeon, the first equipment, the first, all of this is costly. It costs money. So in comparison to the service you are going to take, definitely it's much more less even in comparison to other country. And let me tell you something about it. I have a lot of patients coming from outside, and they did the surgery and coming for treat of complication. So if we are speaking about the cost in this issue, you imagine how much you are going to cost to treat a complication just because you do it in less price area.
Cheaper, yes. That's what I always tell to my patients. Never compromise with price when it's about your health. You can find cheaper solutions in clothes, in cars, everything, but not health.
Not health. That's why I tell you the patients start to be wise now, and the patients start to be يعني, have a lot of information. So they seek for the best, they seek for the unique. That's why I'm telling you, definitely Dubai become now is a hub for this
Mhm.
medical advice. And
Mm.
by the way, this is one of the most important point which make me proud of you or make me respect you, because you always search for the best quality to give it to your patient.
Yes, I do my best to find best top doctors. What makes your center stand out for international patients or medical tourists?
Again, the patient search for a center specialized in a certain disease. So when they search on Google, as they usually did, we are recommended by the International Society, for example, for Surgical Review Corporation, as a center of excellence for this disease. Got my point? In addition to our reputation, lately I start to have a lot of patients coming from Europe, coming from Asia, so this patient, when they are satisfied and they go back to their country, they make a good reputation, and send us their relative or the other patients.
Mhm. And speaking about VIP service, do you offer fast track diagnostics or same day treatments for patients who travel just for health conditions?
All of my patients are VIP. All of my patients. I don't have
Mhm.
all of يعني I don't have other VIP patients. Any patient coming to my room or to my clinic is VIP, and I give him the best service and I give him the best uh, uh, um, quality I can give as a medical service. But in the other hand, if you're speaking about the patient who's traveling from abroad or coming for 1 or 2 days, yes, we provide. I don't want to say a special service, but I want to say we considered in our plan that he is coming only for 1 day. That's why, yes, we arrange a little bit fast track for him as regard the investigation. We can do it and immediately we can do the procedure if he need. Then he can go back to his country within 24 or 48 hours.
What level of privacy and comfort can high profile patients expect at your new center?
Again, the whole we have a team. Um, this team was structured to cover all type of patients, structured to give the comfort for female as we give the comfort for female, for female. So we always, because we are an Arabic country, so we considered to give the best privacy, even for male or female. Each of them take his own privacy, and we consider this in our team.
Many people confuse minor symptoms with something harmless. What are signs that should never be ignored when appear?
Bleeding is the most important and the most dangerous sign for any patient, wherever he saw it, he should seek for medical advice. Because the point is, I saw before a patient like this, and he said, "Oh, no, this is a bleeding from a minor hemorrhoid or from a minor fissure, and by the end of the day, it end by starting growing cancer. So please, if you have a bleeding, if you have an anal pain, again, seek an urgent medical advice. I will be happy when I investigate you and I told you, my friend, you don't have anything. This will be happy for me and happy for you. But till we reach this, you should be investigated.
Okay. What is the screening age for colonoscopy?
Above 40. Above 40, you have to screen at least once per year.
Once per year.
This age, it changed a little bit, become lower if you have
Mhm.
any family history
Mhm.
for cancer colon. Yani if you have one of your relative, especially first degree relative like father, mother, it's better to start screening and an early age. Up to 30, we can start to screen. Once per year, colonoscopy is a must.
Dr. Tamer, what innovations in proctology are you most excited about right now?
Lately, I'm excited to use something named as THD or transanal hemorrhoidal ligation. Again, I told you in the beginning of this episode that I like any treatment which give me some criteria: pain-free, no wound, minimal procedure took around 5 minutes. The patient can go home from the hospital after 1 or 2 hours. It can be done by local or spinal anesthesia, no need for general anesthesia, and the patient can go home uh, next day, same day, and go to his work after 1 or 2 days. This combination we achieve it by THD or transanal hemorrhoidal ligation. Nowadays, we can do it for any grade of hemorrhoid, whatever the grade, we can do it by this transhemorrhoidal ligation. I use a certain machine which is very advanced, containing ultrasound, which detect to localize the hemorrhoid by very high accurate rate, and I just ligate it. I don't do any wound, I don't do any scratch, nothing. So no pain. The patient can go happily to his home after 1 or 2 hours from the procedure.
Okay, and live normal life?
Totally. He can live to normal life. He can walk. He can enjoy his life in the same day. He can go to his work in the next day. This is the magical part of you. You imagine
Mhm.
from before, 10 years back, when we make a normal hemorrhoidectomy, I see a patient after 1 month from the procedure, really they are crying, ya Medina. Really they was crying from
Mhm.
just a wound. You got my point? So when nowadays, that's why I'm telling for every patient with anal issue, please, my friend, don't be afraid. There is no more pain. There is no more struggle. You can do it easily and back to your life easily.
Mhm. How do you see this center of excellence in proctology shaping future of surgical excellence in the UAE and in the region?
See, as a leaders in this type of excellency, any center of excellency are aiming for 2 points: giving the best result with the least rate of complication. So our aim to guide our colleagues to reach this level, the best result and the least rate of complication. In addition, we are used to know the most updated technique in every disease, how we can treat this with the best result. This is the question, or this is the main question in any center of excellence.
Okay. And I believe you are going to spread this excellency in other departments, maybe hospitals,
Actually,
maybe Emirates.
this is one of the secrets which looks like you want to know it. Yes, we are going to start from the next month a training program to our young colleague if they are interested in it, to spread this way of thinking, to spread this technique among, and not only in UAE, it may be in the Middle East. So we will do our mission as the academic mission as a professor. This is how I feel it, and this is what I'm going to deliver in the coming few months, inshallah.
And this is very noble, not just to learn by yourself, but also to teach others
See, by the
the
end of
precious knowledge you have.
this is by the end of the day, I'm a professor before I'm a surgeon. If I don't behave as a professor, I will not be a surgeon.